Hi, today we're talking about osteoporosis. An adult person's skeletal system is composed of numerous networks of other structures that connect the 206 bones and 32 teeth together. This system performs many vital functions in the body, such as giving it form, producing new blood cells, and helping with different body movements. Bones in the body are strong and thick. However, as people age, the bone density decreases. This normal phenomenon starts at about the age of 35, but in some cases, people develop osteoporosis. This is a bone disease where people lose bone density faster than normal. This puts them at risk of a fracture because the bones are getting weak and brittle. One major part of the skeletal system that is usually affected is the spine, or as it's commonly known, the backbone. The backbone helps maintain the body's form and aids in the function of the entire body. Aside from the spinal column, other easily affected areas are the hip and the wrist. What causes osteoporosis? Bones in the body are living tissues that are constantly being broken down and replaced. They are also made of minerals, which are essential in the bone building cycle. The bone structures are influenced by different hormones that are regularly released in the body. Osteoporosis occurs when the minerals and the majority of the bone tissues are lost faster than the creation of new bone. This bone disease can affect both men and women from all races. In studies, however, women are at a higher risk compared to men. The two main types of this bone disease are described more specifically below. Primary osteoporosis. This occurs mostly in women after they pass the period of menopause. It's more common in females over the age of 70 compared to younger women. Secondary osteoporosis. This may be caused by medications like corticosteroids, malnutrition, excessive exercise, or chronic illnesses like anorexia nervosa. Secondary osteoporosis affects young and middle-aged people. Women who exercise too much are at a higher risk because undergoing excessive workout routines may cause irregularities in their menstrual cycle. How can someone know if they have osteoporosis? It is not common to see noticeable symptoms of the bone disease, especially during the early stages. Through time, however, as the bones continue to weaken, they will not be able to fully support the body. Even a person's body weight could cause fractures. These fractures are usually seen in the wrists, spine, or the hip. Still, before bone fractures happen, people may experience lower back pain that is caused by collapsed vertebrae. Individuals can also adapt to stooped posture as the bones weaken and eventually observe a loss in height. As the cycle continues to break down bone density, there can be extreme back pain, which can make a person hurt, even just by standing. How do we diagnose osteoporosis? As there is no obvious physical symptom of this bone disease, doctors have to check the person's medical history first. There is a possibility for anyone to have a low bone mass even at an early age. The doctors will gather necessary information about recent injuries or fractures before proceeding with the bone mineral density test. Bone density in the body can be measured by a special machine that uses low levels of X-rays to see the proportion of minerals in the bones. Most of the time, the bones located in the hip, spine, and wrist are checked. What is bone mineral density, or BMD? Common X-rays are used to see bone structures and can identify specific structures. However, they will not be enough in checking for actual bone density loss. A more specialized means of testing is needed to see the valuable percentages of bone loss. For instance, the most usual type used for BMD tests is the dual energy X-ray absorptiometry, or DEXA. DEXA has low X-ray radiation, which lets it detect small amounts of bone loss. It is used to measure the PDM of the whole skeleton, but mostly it's used for spine and hip BMD. The patient has to lie down on a padded table while the scanner moves over the body. An Undergoing such a test will help the doctors assess the risk of getting bone diseases. PDM Results, Osteopenia and Osteoporosis. There is a specified threshold measurement for this bone disease as defined by the World Health Organization. According to the result, experts identified 4 status labels and their corresponding BMD. Normal bone density has a T-score of -1 or higher. If the T-score is lower than -1 and higher than -2.5, that person has osteopenia. Then a T-score of -2.5 or lower is a mark for osteoporosis. But if the person has the same T-score with additional fragility fracture, then it is under the severe bone disease range. Be reminded, however, that this test will not automatically mean that an individual will have a fracture. There are therapies given by doctors to help slow down the bone loss and prevent fractures. Ways to treat osteoporosis. Doctors will recommend having a healthy lifestyle to prevent this disease. Still, other forms of exercises and medications can help in slowing down the chances of bone loss. The goal of osteoporosis treatment is to help strengthen the bones and protect them from having fractures, because there is no cure for this certain bone disease. Most of the medications will be combined with specific lifestyle changes. Some prescription drugs will be given to patients, such as bisphosphonates. This is the most common drug, which includes various types such as alendronate or Fosamax, zoledronate, which is reclassed, razendronate, which is Actonel or Altelvia, and ibandronate or Beniva. Another prescribed medication is denosumab or Prolia, which is a form of antibody that is connected to the protein involved in the process of bone resorption. This medication is effective in slowing down bone resorption and aids in maintaining bone density. Aside from these medications, there are hormone-related therapies. These forms of defenses are not commonly used. For instance, estrogen is only used to maintain bone density if the person's menopausal symptoms will need treatment. This therapy can put women at a higher risk for breast cancer, blood clots, heart disease, and endometrial cancer. On the other hand, men's bone diseases can be associated with the decrease in their testosterone levels. Doctors might recommend testosterone replacement therapy to their patients to help increase bone density. If other treatments will not work well, the doctors might also suggest teriparamide or Forteo. This is similar to parathyroid hormone. It is a powerful drug that stimulates new bone growth and is given by injection. This drug is commonly reserved for people who suffer in severe cases of this bone disease. If you have osteoporosis or are concerned that you may be experiencing advanced or early bone loss, please contact your doctor. Early treatment is one of the best ways to improve outcome in these conditions.